To this now, the Free State Health Department is concerned about the rapid rise of COVID-19 cases in the province. Officials say the infection rate has doubled over the past week. The Mangaung, Lejweleputswa, Fezile Dabi, Thabo Mofutsanyana and Xhariep municipalities are worst hit. The province recorded 1,500 new cases yesterday. To discuss this, we're joined by Health MEC Montseng Tsiu. MEC, thank you very much for your time. You've raised concern on that rapid rise of COVID numbers. Talk to us about these figures. What have you seen is the trend at this point?
There's a spike of the healthcare workers that are testing positive for the past, starting from last week and this week. And that has put the health services under tremendous pressure, so much that we have requested that the service, the institute, our facilities that are in the same area should share the services. If one facility is buckling under pressure, the other one comes in so that we are able to continue giving the people services without any break.
And then in terms of vaccinations, can you take us through the stats there? Because sometimes there is a correlation, sometimes not. But can you take us through the stats in the province? Are you seeing a large number of people coming to vaccinate now with the Omicron variant?
Not really. The people are, in fact, instead of the people coming in numbers, we have seen the numbers dropping. But at the present moment, our vaccination rate, we have now been able to vaccinate 52% of our adult population. This has been assisted by us going to the people, closer to the people. We are creating the pop-up sites closer to where the people are staying, so that then people can easily access the facility of the vaccination. And now, when the schools closed, we saw the younger generation, especially the 12 to the 18, their numbers grew. We are at 17% now, but that time when the schools were still going on, there were no young ones coming to come to vaccinate. We are really struggling to get this age cohort, 35 to 50. We are struggling. Those people are really not coming for the vaccination. But the 50 to 59 and 60 years and above, well, we are happy with them. We are at 69% at this point.
All right. And then in terms of hospitalization, what have you observed? Are you seeing a lot of those who test positive being hospitalized in the province, or it's similar to the other province where it's very minimal, where you have those very severe cases? And beyond that, can you talk to us about capacity that you have currently to deal with any eventuality?
Yeah, let me start with that one. We do have capacity at the moment, and a lot of our beds are not occupied. We are like other provinces. Whilst we see numbers growing of people testing positives, but very few of them end up in the hospital. They don't really require the hospital. Even our own staff, the healthcare workers, they've tested positive, many of them, but all of them are at home, isolating at home without requiring any hospitalization or to be given oxygen or to be in the ICU. At this point, we have a total of 205 patients admitted across the province that are affected by the COVID-19. So we've seen the spike, the numbers going up of the infections, but not a severe illness.
So today is the 16th of December. People are celebrating. It's Reconciliation Day, but for others, it's a holiday and they're enjoying themselves. Gumnandi, what would be your message to those in your province and generally the nation?
My message would be, can people, those that have not vaccinated, continue visiting our vaccination site to get vaccinated? And those that have vaccinated, because when you are vaccinated, it does not mean that you cannot get the infection. Continue observing the protocols like wearing the masks, observing the social distancing, washing the hands with soap and water, and also using the sanitizer. Because it does not mean that when you are fully vaccinated, it says you cannot get infected. You can get infected and also infect others.
Most certainly. Let's continue to observe those health protocols. MEC, thank you very much for your time.